Hello, this is Dan Holscher with Senior Mark, and today I want to talk to you about probably one of the most important and the most misunderstood parts of Medicare and what a beneficiary's choices are in how to get their Medicare coverage. And this is called two choices. It's the traditional Medicare system versus Medicare Advantage. And when it comes to your Medicare coverage, you as a Medicare beneficiary, you have two options in how you want to get your Medicare coverage. The first option is the original or traditional Medicare system. It consists of Parts A and B of Medicare, and the original Medicare system is operated by the government and government subcontractors, and how it works is Medicare pays a set fee for your care directly to your doctors and hospitals. Now, there's a second option that you have in how to get your Medicare coverage, and that's through Part C of Medicare, or the Medicare Advantage program. Now, the Medicare Advantage program, it is operated by private insurance companies, and it's approved by Medicare based on whether they're meeting the minimum requirements. The way these plans work, Medicare pays a fixed fee to the plan, the private insurance company, for your care. The plan then pays the doctors and hospitals. Now, key here is the or. You will not have Medicare Part A and B and Part C. You will have one or the other, and that's a choice that you get to make. Now, if we look at the original Medicare system first, and this is Part A and Part B of Medicare, most people will not pay a premium for Part A. They've worked long enough, or their spouse has worked long enough for them to qualify for no premium Part A. Part B, on the other hand, for most individuals, in 2012, it costs $99.90 per month for Part B. Now, that can be indexed higher for those with higher incomes, but for most people, it'll be $99.90 a month. Now, if you remember from our previous video on traditional Medicare and how it works, you'd know that there are gaps in traditional Medicare. Medicare does not pay all of your bills. Because of that, most people will choose to add a Medicare supplement policy to fill in those gaps. Now, there are a total of 11 plans that you can choose from, depending on how much coverage you want to cover these gaps. And those plans can range from probably as low as $50 a month up to approximately $135 a month, depending on how much of the gaps you want covered. So that's a decision you get to make based on your budget. Now, because Medicare, traditional Medicare, nor supplements cover prescription drugs, most people will choose to add Part D of Medicare to take care of the prescription part of their plan. So that's the traditional Medicare system. Now we'll move on to Medicare Advantage Part C. Go back here. With Medicare Part C, these plans have become extremely popular, in my opinion, for the wrong reason. They've become popular because these plans a lot of times have a very low to no monthly premium in addition to Part B of Medicare. Now, it doesn't matter whether you choose traditional Medicare A and B or Part C, you still have to pay the Part B premium of $99.90. That's the same no matter which option you choose. But many of the Part C plans, there are many out there that have a $0 premium. The reason for that is because since Medicare A and B is not paying your bills, traditional Medicare, the Center for Medicare and Medicaid Services, can fund the Medicare Advantage plans to take care of you. So with Plan C, if you remember, you can watch our video on Medicare Advantage plans to get a sample of how they cover. But with Plan C or Medicare Advantage plans, they will have copays, deductibles, co-insurance amounts, and then they will typically set a maximum annual out-of-pocket. Most of the Part C plans have, at least the $0 plans, have a maximum out-of-pocket of around $4,800. Now, one of the other nice things about Medicare Advantage plans is a lot of them, not all of them, but a lot of them will also include your prescription drug coverage in with it for that same low to no monthly premium. Now, that can be good or bad because with a Medicare Advantage plan, you don't get to pick your drug plan. You just get the one that they add to it. So sometimes your medications will be more expensive in a Medicare Advantage plan than they would out on your own. So that's something just to keep in mind. So now let's move on to some of the positives and negatives of both plans. First looking at original Medicare A and B. Some of the positives: number one, you're free to use any doctor or hospital that accepts Medicare. And as of now, most doctors and hospitals do accept Medicare, so you have a lot of freedom in where you get your care. There are very minimal out-of-pocket costs on your medical coverage because you can choose to get a supplement plan to supplement A and B. So you can have a plan like a Plan F Medicare supplement policy where between traditional Medicare and your supplement, as long as everything's Medicare approved, you would have zero out-of-pocket costs. The plans are usually predictable from year to year. That's because supplements change along with Medicare. So if Medicare raises their deductibles and their coinsurance, in other words, their gaps, in the past, supplements have raised the amount they cover so that their plan continues to cover just like it did the previous year. Another thing, the supplement plans in traditional Medicare cover you the same out of your home state as it does in your home state. So that can be very important for snowbirds that like to go to Florida for 3 or 4 or 5 months a year. Their plan will cover them in Florida just like it does in their home state. The main negative to original Medicare and a supplement is you have to pay an additional premium for your supplement and your prescription drug plan in addition to your Medicare Part B premium. So that's really the primary negative, but I'm under the opinion that sometimes you get what you pay for. Now, moving on to the Medicare Advantage, some of the negatives usually are just the opposite of what the pros are over here. The negatives: you may have to use in-network doctors and hospitals, or providers must agree to the plan's terms and payments. If you remember in our conversational Medicare Advantage plans, there are PPO, HMO, and private fee-for-service plans. So some of the plans you have to use network doctors or you're not covered. So that's important to understand. You have copays and coinsurance based on the services used. So you may have doctor's office copays, deductible periods when you go into the hospital. And the key thing, you can't get a supplement to pay those for you because a supplement is designed to work with traditional Medicare, not with Medicare Advantage plans. Plans only contract with Medicare for a 12-month period, so your benefits may be unpredictable from year to year. Medicare, they set the guidelines and they contract for the year. At the end of that year, the Advantage plans can choose to change their benefits and premiums based on, a lot of times, the subsidy that they're getting from the government. So that can mean they're unpredictable. A good example of that is a very popular plan when it first came out in January of 2006. It had a zero premium and a maximum annual out-of-pocket cost of $2,000. That same plan for 2012 has an $89 a month premium, and its maximum annual out-of-pocket cost is $4,800 for the year, potentially $7,500 if you're out of network. Another key thing to remember: the Medicare Advantage plans only cover you out of your home state in the case of emergency. So you can't use your plan out of state like you do in your home state. You're only covered for emergencies. Now, there are a few plans that I know of that they do have some states that you can use it in and limited areas where you can use it just like your home state. But as a general rule of thumb, at least now, they only cover you in a case of emergency. Another thing, if you want to go back to the original Medicare system, you may not be able to get your supplement back. Now, every year during that annual enrollment period from October 15th through December 7th, you could always leave your Medicare Advantage plan and go back to traditional Medicare A and B. but you may not be able to get your Medicare supplement back, because as of now, supplements can accept you or decline you based on your current health. And that's very important to know, because a lot of instances people are very happy with their Medicare Advantage plan because it has a zero premium, and if they're not using it much, they are definitely winning the game. But what we've seen happen is somebody has a Medicare Advantage plan, they get sick, develop a health condition, they start seeing some of those out-of-pocket costs, they want to go back over to A and B. Well, they can go to A and B, but because of the very health condition that caused them to claim on this side, they can't get their supplement back. So that's something you want to know up front and not after the fact. And I know a lot of people that are in Medicare Advantage plans, they are not aware of that. And finally, Medicare Advantage plans only have to be as good as original Medicare by itself, just A and B. So it's definitely not as good as A and B plus a supplement. The major positive to these plans is the fact they have a very low to no monthly premium in addition to Medicare Part B. Now, with all that said, our professional opinion is that your first option should be to look at traditional Medicare and adding a supplement and drug plan to it. Now, we know that not everybody's budget will be where they can pay that additional premium. So Medicare Advantage plans can be a good option for people, but we don't believe it should be your first option. You should look at this first and then look at this as a secondary or something in case your budget just doesn't support it. And for some people, they're willing to take this risk to have that low premium, and that's fine. There's nothing wrong with that. We just want people to understand what they are and aren't getting, which a lot of times people aren't getting that information from salespeople. So that concludes our discussion of the two choices that you have. It's a very important decision to make because some decisions you may not be able to reverse down the road. So if you have any other questions for us, or you'd like to schedule a free consultation, we'd be happy to answer any questions you might have. Just give us a call toll free at 877-492-8803, or you can email me directly at dan@seniormark.com. Thanks for joining us, and have a great day.